I'm Dr. Jim Richardson. I've been a practicing dentist in Washington, D.C. for 30 years. And I've had the privilege of being able to help a lot of patients with their TMJ or their jaw joints and the pain that will happen when those joints are in spasm or there's a disorder of those joints. And I'm here to explain to you the science behind that, what we're able to do to help, and the process we do in order to achieve that. The main premise is that any muscle, if it's overworked, will go into spasm and become painful. If we look at our shoulder and we allow our arms to relax at its side, those muscles are at rest and they can stay there for a long time and not give you any trouble. If you hold your arm out to the side, then the muscles are working. And if you keep your arm out to the side at a long time, those muscles will eventually fatigue, go into spasm, and become painful. So the same principle applies to our jaw joints. If the joints are in the position that they're supposed to be, which is a bone-braced position, that allows the muscles to relax, and that joint can work a long time in that position. If, however, our jaw is shifted so that that joint or one or both joints are not in a bone-braced position, but in a muscle-braced position, those muscles will eventually be overworked, go into spasm, and be painful. Let me show you what I mean by a bone-braced position. This is a model of a jaw, and this is representative of the jaw joint. And the key is there's ligaments and there's muscles around that bone that cushion it from this bone, but this should be in that socket all the way, where the muscles are able to relax in that position. And the key is to have the way the teeth come together be in harmony with that, so that when your teeth come together, that joint is in that bone-braced position. Because there's three-dimensionally, there's bone here where it's braced against, but it should be symmetrically in that TMJ socket, or in the socket of that joint. If, however, your teeth are not in harmony with that, so then you have to slide your jaw one way or another to get your teeth to come together, then that dislocates the joint from the socket. And then you're no longer in a bone-braced position and you're in a muscle-braced position. So it's just a matter of time that those muscles become overworked and you'll get spasm and pain. And muscles relate to one another. So it's not just this area that the pain will emanate. It can often be in this area, but it often goes up to the temples. It often goes down to the muscles of the neck. It often goes to muscles in the back of the head. It can cause symptoms that are headaches, that can seem a lot like migraines. If you find that the pain is more predominant in the morning, then there's a very good likelihood that you're subconsciously clenching or grinding at night, which we find happens a great deal of time in a lot of people that aren't aware of doing it because they're doing it subconsciously. The key to interrupt this is to first diagnose exactly how your teeth relate to your jaw joints. And the way we're able to do that is there are jaw simulators that will show us exactly how your jaw closes in relationship to a simulated jaw joint. So we get the same arc of opening and we can see the exact same bite, and that allows us to do planning. So when we have a case that starts, say, like this, then we're able to keep things in harmony with the jaw joint, plan where things are supposed to be, and we can take this case and design it into a case that is in harmony with the joints, that things like pronunciation for speech, that everything is positioned in harmony with the lips and the joint. It's basically the teeth are where they're supposed to be. Now for just looking at the bite, it's much more simple than this. Then we're looking at the shapes of the teeth, and we're able to, in many cases, make an appliance that you wear at night that absorbs most of the force that the teeth and the muscles would otherwise absorb. There are times when we adjust the teeth themselves so that we see how the teeth come together. And before we do that in your mouth, we have two sets of models, and we have one that's like a before, and we have another that's an after, and we can see exactly what needs to be done in order to achieve the harmony of the joint and the teeth. And this is something that has been around for a while. It's very predictable. Thanks in large part to Dr. Peter Dawson, who wrote the definitive textbook on the subject in 1972. This textbook, out of all dental textbooks, out of every range and specialty of dentistry, this was the best-selling dental textbook for 25 years. And then it got supplanted from #1 by an implant book, which was a very groundbreaking book on its own. And the Dawson textbook became the #2 best-selling dental textbook at that time. But that was after 25 years of being in the #1 position. The book is now in its second edition, and I think it's already in its third printing. This is science that has been around for about 40 years. It's got an amazing track record. It's very predictable. Now, there's other things that can cause, like migraine headaches. They can be related to the same muscles. They can also be other entities. There can be osteoarthritis. There can be changes of the bone. There can be a tumor. There can be breakdown. It's important for us to be able to rule out those types of things, and there are some relatively simple tests that we can test how much pressure the jaw joints are able to take, and if they're able to absorb the normal amount of load, that is a very good indicator and will often rule out a lot of those other entities. And then we find a correlation between a muscle that's sore, which is a direct muscle that works that joint, and we see a correlation between that and an interference in the way the bite comes together. Those are the types of things that we look for, where we know that it's just showing us a direct correlation, and working on the bite will be helpful. Now, when we make an appliance that is non-invasive, it's completely reversible, and generally patients find that this will be often a godsend to them, because they can feel the difference in the muscles. They can feel their range of motion improve. They find they get great help with the pain, and it's something that they look forward to wearing it at night. And if by chance they misplaced it or it's not around, they are much more comfortable when they have it, and it just becomes second nature and a part of them. I must say that if you've never worn an appliance, to begin wearing an appliance, it's an accommodation. And it takes an average patient a couple of nights to get over the hump of wearing something in their mouth. But once you get over that, then it becomes second nature. And if you don't have it, that seems odd. So what I'm going to show you next is how we can take records and models so that we can put models of your mouth or a patient's mouth on a jaw simulator and see exactly the same thing that's going on in their mouth, and have it on a jaw simulator so that we're able to use that as a baseline to plan what treatment is appropriate for that patient. Thank you.